Hello, I'm replying to the video on the congestive heart failure. I just want to tell you I think you did a fantastic job, especially covering the signs and symptoms that the lady came to the ER with, especially covering right-sided heart failure as well as left-sided because that's more of a comprehensive view. Even though we do see left-sided heart failure, quite a bit more clinically, or I have in my practice. Anyway, I was really glad that you brought up that the lady came in with an LVAD and that it was end-stage LVAD. I worked open heart recovery, and we did LVADs and heart transplants as well as open heart surgery and valve transplants, and most of our LVADs were for transplant. We did maybe a couple in the 5 years that I worked there that were end-stage heart failure, but mostly it was for a bridge for transplant, and it was such a joy when those patients came in and they got their heart, because we took care of them post-op LVAD placement, and then when they got their heart, we took care of them post-transplant. So it was just a really happy time. One thing I just wanted to point out about the LVAD that maybe some people don't know, or some of y'all don't know, is it's a lot of intense education for the family. It's a lot of family screening and a lot of family education. When they do commit to it and they do, find out that the patient is a candidate for heart transplant, they will go to their house, talk to the electric company that services their house. This was in University of Virginia, and they really highly recommended that the patient would get a generator, because these things are completely run on electricity, battery power. They have to have batteries on standby. So the battery life the battery life also increases in demand also. But if they have to change out the batteries, it's important that they rotate the batteries so that one set doesn't get weaker than the other. There's a lot of intense education on teaching the patient how to change the battery, mainly because if they don't have the battery, they can die. Within, minutes, they can die because they don't have the heart pumping. Another interesting thing is that these patients have to be anticoagulated because the blood in the device can clot, and it can, throw out microclots to the patient, so they have to be anticoagulated. They have a drive line that comes out of them, and the pump itself cannot get wet in any way. They have a shower bag. It can never be submerged. They have a shower bag because it is an electrical device. But yeah, I was really, really happy that you brought that up, because that was a very interesting case, and all aspects of it you covered wonderfully. Okay, that's it. Bye-bye.